Good afternoon. Thank you for joining us. I'll start as usual with an update on the latest COVID figures in Scotland. Since yesterday, I can confirm that an additional 8 cases have been confirmed, which takes the total number now to 18,259. A total of 785 patients are currently in hospital with suspected or confirmed COVID-19, which is a decrease of 100 since yesterday. That includes a decrease of 11 in the number of confirmed cases. You'll recall that yesterday there was quite a big increase in suspected cases, so clearly that has gone in the other direction today. As of last night, 17 people were in intensive care with confirmed or suspected COVID, which is 2 fewer than the number I reported yesterday. Since 5th of March, 4,071 patients who had tested positive and needed hospital care have now been discharged from hospital. Unfortunately, in the past 24 hours, 1 death has been registered of a person who had been confirmed as having the virus, and that takes the total number of deaths in Scotland under that measurement to 2,486. In addition, as is now usual on a Wednesday, National Records of Scotland has just published its more detailed weekly report. This publication, like our daily figures, includes deaths of people who had been confirmed by a test as having COVID, but it also includes cases where the virus was entered on a death certificate as a suspected or contributory cause of someone's death, even if its presence had not been confirmed by a test. The latest NRS report covers the period to Sunday just past, 28th of June. At that point, according to our daily figures, 2,482 deaths of people who had tested positive for the virus had been registered. However, today's report shows that by Sunday, the total number of registered deaths with either a confirmed or a presumed link to the virus was 4,155. Of those, 35 were registered in the 7 days up to Sunday, which is a decrease of 14 from the week before. And this is the 9th week in a row now in which the number of deaths from COVID has fallen. Deaths in care homes made up just under half of all COVID deaths last week, and the number of COVID deaths in care homes reduced again from 20 in the previous week to 16 in the most recent week. Finally, and very significantly today, I can report that the total number of deaths recorded last week from all causes, not just from COVID, was 20 below the 5-year average for the same time of year. This is the first time since March that the total number of deaths has been below the 5-year average. In other words, the first time since we don't have a number of excess deaths above that average. And to put that in context, last week it was 46 higher than average, and 11 weeks ago the number of deaths recorded in a single week was 878 higher than the 5-year average for the same time of year. So this week's statistics again tell of the real and sustained progress that we are making in tackling COVID. That said, the numbers also speak of heartbreak for many of our fellow citizens. We can take some comfort in the trends shown by today's data, but we should never ever lose sight of the fact that every single death represented by these numbers is a tragedy. And I want to send my heartfelt condolences to everyone who is grieving right now as a result of losing somebody to this illness. I also want, as I always do, to thank our health and care workers and all key workers. We continue to be grateful for all of the contribution that you are making. Now, in tomorrow's media briefing, I hope to be able to confirm that we're going ahead with many of the Phase 2 changes that have already been signalled. Today, though, I want to highlight a couple of things which demonstrate in different ways how the progress we've made in addressing COVID is starting to allow a return, a very careful return, to some greater normality, although life still should not feel like normal. The first is that from today, our Warmer Homes Scotland programme will resume. Warmer Homes Scotland tackles fuel poverty by giving help to those who most need it to make their housing more energy efficient. It therefore cuts people's heating bills and it reduces our total greenhouse gas emissions. The scheme's restart also means that more than 300 staff are being brought out of furlough so that they can get back to work improving people's homes. Overall, therefore, the resumption of Warmer Homes Scotland is good for employment, for the environment and for those households across the country whose homes will become easier and more cost-effective to heat. The resumption is also one further sign, not a huge one, but still a significant one, that public services and economic activity are starting up once again. The second issue I want to touch on relates to children and young people. Much of the discussion about the changes we hope to confirm tomorrow will understandably be around issues such as changes to travel restrictions and the reopening of some parts of the hospitality sector. But we know that this has been an incredibly difficult time for children and young people. It's been very tough not going to school for an entire term and then being so restricted in how you can meet up with and play with your friends. These restrictions have also, of course, made things more difficult and challenging for parents and carers. We're therefore keen to make some changes which will help to make this a slightly more normal and less frustrating summer holiday for many young people. So tomorrow I hope to confirm more details of that. Tomorrow, the Chief Medical Officer will also announce some important changes in our advice for some children who are shielding, who until fairly recently had been advised to stay completely at home. All of our children and young people, in my opinion, have responded incredibly well to an incredibly difficult situation, and I'm grateful to all of you for that. Indeed, I'm proud of all of you for that. But we know how important it is for you to be able to see a bit more of your friends over the summer, as well as, I hope, being able to go back to school in August. Tomorrow's announcements, therefore, I hope will set out ways in which you can do that, and as a result, hopefully, it will allow you to get a bit more from the summer holidays. Now, I want to close by emphasising again our key public health messages. In a moment, I'm going to hand over to Jason Leitch, who will share some information with you about a cluster of cases that has recently been identified in the Dumfries and Galloway area of Scotland. And that, as well as being important in its own right, is also a reminder for us, a sharp reminder for us that COVID is still out there. So it is really important that all of us continue to follow the public health advice that is being given. So I want to take the opportunity, as I always do, to emphasise these key messages and to emphasise the fact that things like hand washing, while always important, becomes far more important when we start going out and about a bit more important than even these kinds of measures were when most people were staying at home all of the time. That's why I ask you to familiarise yourself with and remember the facts campaign that we have been running for the past week or so now. That summarises the 5 key things that all of us must remember and must abide by if we're going to be able to keep this virus at bay. So firstly, face coverings should be worn in enclosed spaces like shops and public transport. I'll say more tomorrow about face coverings in retail. Second, avoid crowded places, even outdoor crowded places, because the risk of transmission in a crowded place is high, and please don't take that risk. Thirdly, clean your hands regularly and avoid touching hard surfaces if you can, but when you do touch hard surfaces, clean them thoroughly too. Fourthly, 2-metre distancing remains our advice. And lastly, self-isolate and book a test immediately if you have any of the symptoms of COVID. And remember, those symptoms are a new continuous cough, a fever, or a loss of or change to your sense of taste or smell. And don't wait to see if you feel better. If you have any of these symptoms, book a test immediately, and you can find out how to do that by going onto the NHS Inform website. If all of us follow these 5 basic measures, it doesn't mean that there won't be risks and potential setbacks in the weeks ahead, but it does mean that collectively we are minimising those risks and we're giving ourselves the best possible chance of building on the progress that we've made over these past 3 months and not allowing that progress to be squandered. So I appeal to all of you to keep following this advice and to think very carefully each and every time you go out of your house about the things you could be doing that give the virus a chance to spread, and conversely, how by following the advice in the facts campaign, you can minimise or remove those risks. So my thanks for your cooperation and compliance to date. Please, please keep doing it. I'll hand over now to Jason Leitch, and then we will, as always, we're also joined by the Health Secretary today, and the 3 of us will take questions from the media.
Thank you, First Minister. At this stage of the pandemic, it is crucial that we pay attention to local potential outbreaks, as well as the picture across the whole nation. And we're closely monitoring that across Scotland for local infection clusters. You will have seen perhaps in the news this morning that in Murray there have been reports of infections in 2 workers carrying out construction work at the RAF base in Lossiemouth, following testing carried out by their employer. These were antibody tests. They, if you recall, suggest previous infection, not present infection, and therefore a much less infection risk to those around them. However, these 2 individuals are isolating, they are being contact traced, and they were yesterday had PCR antigen testing in Inverness, and we await the results of those tests. NHS Grampian are fully engaged with all of the organisations involved there, including the contractor, and are seeking clarity on exactly the testing that took place and doing their own version of that testing to ensure safety across that workforce and the wider community. I can also advise today of a cross-border cluster of cases between the northwest of England and Dumfries and Galloway. A number of cases have been identified around Gretna and Annan. It's worth noting that the last positive case in Dumfries and Galloway Health Board was on the 22nd of June. This is a complex but small cluster captured in different testing areas, in a hospital testing site, in a mobile testing unit, and in a drive-through testing unit. And they came together in what Dumfries and Galloway brought together yesterday, a problem assessment group to consider these cases and link them. A full cross-border incident management team will meet later this afternoon, and this IMT will review the actions on both sides of the border and the case information and take appropriate action. Of the cases in Dumfries and Galloway, I can confirm that Test and Protect has been fully initiated immediately. Contacts are being traced and provided with the appropriate public health advice, as you would expect. There is sufficient testing capacity in the Health Board to carry out all appropriate testing that's required, and we will send mobile testing units if they require to be deployed. That includes, should there be any necessity, to provide testing at individual workplaces. Clearly, incidents like this reinforce the importance of our Test and Protect model, quickly identifying potential clusters, ensuring contacts are traced quickly, and provided with appropriate public health advice. This applies to you whether you're in Dumfries and Galloway or anywhere else in the country. If you have symptoms, self-isolate, arrange a test, and take all the instructions you are given by those who contact you. Thank you, First Minister.
Many thanks indeed, Jason. I'm going to move straight to questions now. Fiona Walker from BBC Scotland is the first of those.
Good afternoon. Just to pick up on what you just said there, Professor Leitch, can you give us an idea of the number of people involved and when that was first identified, when the first positive case was identified, so that we can get an idea of how long it takes for these to become public? And also just on the test and trace system, it would be good if we could pin down a few points as to whether everybody is being contacted within 48 hours of a positive test, and whether we are getting every single positive case in the figures that you publish every day here, and whether there are any other cases within Scotland, any other areas that you're concerned about.
I'm going to hand over to Jason to give what more detail he is able to give about Dumfries and Galloway, but please understand this is an ongoing investigation and an ongoing process of taking appropriate action. So it may be that not all of those questions can be answered definitively right now, but you will recall in terms of the timing that in yesterday's figures there were 5 positive cases allocated to Dumfries and Galloway, and as Jason said, those were the first positive cases in Dumfries and Galloway for a number of days. So that obviously triggers a concern, and a process of investigation kicks in. In terms of the figures we report on a daily basis, just to be very clear, we now report we report positive confirmed cases. Previously, as you will recall, our reporting was only those cases that had gone through NHS labs. We then reported cases that came through the UK-wide systems, the drive-through centres, but for a period weren't breaking them down into positive, negative, because we didn't have that data in the required form. But what we now publish at on a daily basis are the tests that come through NHS labs and the UK-wide systems. We are on top of that, building more sophisticated surveillance systems that allow us to get as early a warning of any clusters or outbreaks as we can, both at national level and at local level. But of course, one of the reasons it's so important to get the test and protect message across is that by definition, the cases we are reporting every day are those that have been tested, those that have come forward in one way or another and been tested. You will not appear in these figures if you have symptoms and don't come forward for testing or don't end up in one of the other routes that get you tested. So if you have symptoms, come forward immediately for testing, and I can't stress the importance of that advice enough. Jason.
So our understanding, and again, caveats around this being moving even as we speak. We were getting briefing just in the 5 minutes before coming to speak to you. We understand this cluster is single figures and it is cross-border. That adds a complexity because some of the testing will have been done in England and some of the testing will have been done in Scotland. The teams have brought that together and discussed it at that assessment group yesterday and decided these cases are connected. So therefore, they are going to put in place a cross-border incident management team, which is exactly what Health Protection Scotland are meant to do with Public Health England, and make sure that we are managing everything we can around the family, the workplaces, and everything else. Contact tracing has already begun. Contact tracing begins from the moment the positive test is given to an individual, whether that's in Murray or in Dumfries and Galloway. It's important, no contact tracing system is 100% foolproof anywhere in the world. We have confidence in ours. We're very confident that the professionals who do it, the health protection teams that do it, are good at it. They are led by people who have been doing this for many, many years. They will contact trace appropriately, and they will do that just as fast as they can. So if they can do that within 2 hours and contact somebody, they will absolutely do that. Sometimes, clearly, it takes a little bit longer to contact people by phone or in their workplaces. So that will happen as quick as we can, and that will contain the cluster. If that works properly, it will contain the cluster. And clearly, we will keep that under review, and we will continue to monitor cases both there and around the country.
Okay, thank you. Ross Govins from STV.
Thanks, First Minister. Good afternoon. Just a follow-up on that. You say you hope that it would be contained through test and protect. Would you consider further measures, and what may they be, whether that be in Murray or in Dumfries and Galloway? And do you have a margin of error for test and protect? How many cases potentially could be slipping through the net?
Well, this sounds like too flippant a way to describe this, but it is the phrase that comes to mind. The rule of thumb is you have to try and catch at least 80% of the index cases through a test and trace system. Obviously, we work and will continue to work as the system develops and beds down to capture as many as possible. But that's why the advice to the public is so important. If you have symptoms, come forward and err on the side of caution. If you wake up with one of these symptoms one day, even if you otherwise feel fine, come forward to get a test. And if that test is negative, all good and well. But if it is not, it means that we quickly can start to contain any possible outbreak associated with that. In terms of what further action we would take, these are things that are under ongoing discussion and will continue to be. Our aim, as far as possible, is to contain any clusters and any outbreaks through the kind of arrangements and the kinds of interventions that Jason has been describing. Clearly, if at any point in any area we worry that that is not possible, then of course, we hope we don't get into this situation, but I suppose this has been seen in Leicester in recent days, other interventions might become necessary. But our aim, and this is, you've heard me over recent days talk ad nauseum, as I'm sure it feels, about the need to drive this thing as low as possible, as close to elimination as we can. Because if you get it to that level, that means that these flare-ups that we will inevitably see can be, laser like controlled in a way that is not possible if you have flare-ups on a higher baseline of infection, where it then becomes much easier for everything just to run away from you and run out of control. So, as Jason said, there is no system of test and trace and test and protect that is absolutely foolproof. There are no systems that are foolproof, but we are trying to do this in that way. And although everything associated with this virus is concerning and causes people anxiety, and I include myself in that, I do think people should also take some assurance from what Jason has just been outlining, because that shows that these systems are in place and these systems are kicking in when they need to. And as we learn from experiences like this, of course, if we need to adjust them, we will. But people should take reassurance as well as understandably having concern about the information that we are conveying today.
I would only add that this is no comfort to those who have tested positive and their families who will be worried. And I absolutely understand the nature of that healthcare, and the NHS will wrap around them and give them all of the guidance and support they require. But actually, clusters are easier to deal with than sustained community transmission. So we can use precision public health measures, health protection teams, to manage that individual cluster and control it. That's a much easier process than having to suggest to the Cabinet Secretary and the First Minister that we've got community transmission again, could you please think about locking down either an area or the whole country? So this is exactly what we expected to happen at this stage of the pandemic. And I have confidence in the health protection teams to manage it, and we will continue to monitor that and advise the politicians appropriately.
Thank you. Alan Smith-Bauer.
Thank you, First Minister. Can I ask you, first of all, just for your response to Scottish Secretary Alistair Jack, who has said that talk of quarantining English visitors in Scotland is irresponsible and undermines business. Boris Johnson at Prime Minister's Questions has also described it as astonishing and shameful. And secondly, on the point in regards to the 2 positive tests at RAF Lossiemouth, Murray Firth Radio has been told of concerns stretching back to April about contractors coming and going from the area, and with around 100 workers drafted in to carry out essential work on the Murray airfield, which could last into 2021. What assurances will you be seeking from any project involving cross-border contractors?
I'm going to hand over to Jason to answer the part of the question about Murray. And part of the reason I'm going to do that is to separate out the really vital public health challenges that we are dealing with right now from the absurd and ridiculous political statements that I am, understandably being asked to respond to. Dealing with a virus that we have learned over these past 3 months is potentially deadly, and as we are increasingly learning, is also very dangerous to people who don't die from it but can be left with long-term health implications. A virus that is highly infectious and can do the damage we've seen it do. The decisions I take and the Scottish Government take to tackle that virus must be 100% driven by public health considerations. What is it that we need to do to break the chains of transmission and mitigate against the risk of cases in an area of high transmission coming into an area of lower transmission and then risking outbreaks there? That is not political. That is not constitutional. That is public health. And I would be irresponsible if I had a consideration around this that was political, that was therefore preventing me doing what is necessary in case somebody accuses me of being political. That would be when I was failing in my duty as First Minister. And what I would say, and opposition leaders perhaps can be excused a little bit more around this because they're not in the day-to-day dealing with this in the way governments are. But frankly, a Prime Minister or a Secretary of State who, in a government sense, is dealing with the same issues I am right now to try to politicise these things is shameful and is unacceptable. And perhaps everybody needs to look around the world right now. Well, firstly, at home, just make sure they understand what we're dealing with here and how it spreads and the things we've got to do to try to stop it spreading, which are some of the things we're talking about right now. How do we stop a cluster of cases in Dumfries and Galloway getting into other parts of Scotland or going south of the border? That's about how a virus spreads. It's not about politics or a constitution. And as well as looking at these issues at home, look around the world right now. The Governor of New York today, and you can find this on Twitter, has put out information about the states in America from which people going into New York will be quarantined for 14 days. Now, I don't think the Governor of New York has been political or constitutional there. He's just looking at a situation where transmission in New York has been driven down and other states it's much higher. So he's trying to protect the people he serves from being exposed to further spread of a virus. That's responsible. And this is not a political challenge we're dealing with here. I look forward I very much look forward, because it will mean we're out of this crisis situation, to getting back to the day where I can have straightforward political and constitutional debates with my opposite numbers. And I will relish that as a politician, as somebody who has very strong beliefs. But right now, I have a duty, and it's a duty I take really seriously, to protect Scotland from this virus. And I have no plans at the moment, because the situation right now doesn't necessitate it, to have any consideration around quarantine for people coming into Scotland. But if that changes, and the advice I am getting is that that would be a necessary measure to protect people in Scotland from a resurgence of this virus, then I would be failing in my duty not to consider that. Just as the Governor of New York undoubtedly would be failing in his duty if he didn't impose quarantine on people coming in from some of the states in America just now where this virus is running out of control again. So I would say to people, anybody you hear politicising this or trying to turn it into a proxy debate about Scottish independence or the Constitution, they're the ones who are being reckless, and they are the ones who are failing the public health test. And I am going to continue to take these decisions on the basis that they need to be taken. Jason.
I think in relation to the Murray case, that it's very important to emphasise what we know. There are no positive PCR antigen tests in this story yet. We are testing the individuals who have tested antibody positive. It would be unlikely that they would test positive for an antigen test if they've had previous infection. That would be global news if they have a second infection. That hasn't happened anywhere in the world. So I think we can, as far as possible, reassure the public that what can be done is being done. However, on the Cabinet Secretary's instructions this morning, we have, of course, been in touch with the company in question, and we have emphasised 3 types of guidance that are in place in Scotland. The testing guidance, what you should do for that kind of workplace, and how you should engage with the local testing that is available. Workplace guidance, mitigation that's in place, the physical distancing elements, to make sure the company, the location, the RAF base understand what that workplace guidance says. And thirdly, the transportation guidance. So commuting, what makes that safe, what makes it unsafe, how they should do that. So we have been in touch, public health colleagues in Grampian, with the organisations in question to emphasise and ensure that everybody, even if they don't permanently live in Scotland, understand, forgive the shorthand, the Scottish rules for working here and for engaging in the Scottish Health Service here.
Thanks, Jason. Katrine Bussey from PA.
Hello, First Minister. I also wanted to ask about the new cluster that has emerged in Dumfries and Galloway. Is there any indication as yet that this might be linked to a particular event, I wondered? And also we've seen with the situation in Leicester that local leaders down there have complained that they didn't have the up-to-date information that they needed to see the problem as it was emerging. And I just wondered if local authorities here and local health boards could see the robust up-to-date figures to potentially see if there was a spike in cases and to nip it in the buds.
Well, as I understand, I'll hand over to Jason a little bit. I have no information right now that connects the positive cases in Dumfries and Galloway to a particular event, but the investigation is ongoing, and we'll see where that takes us. As Jason said earlier on, we have a reasonable ground for believing that these cases are connected to each other, but again, investigation is ongoing. In terms of the information we are looking, so the situation that we are talking about in the process that kicked off yesterday kicked off because of the published information that showed after a period of no confirmed cases in Dumfries and Galloway, there were yesterday 5 positive cases confirmed. There was some discussion yesterday about local authorities only getting what's called in England Pillar 1 tests, which come through NHS labs, not Pillar 2, which come through the wider testing network. The figures we publish here cover both of those routes. But as I said earlier on, we are working right now, and this will be a continuing process, to strengthen and deepen the the data, not just testing data, but early warning data that is available for us at national level, but that would also be available for local councils to get as much heads up of any emerging problem, because the earlier you detect it, the more chance you've got of stamping it out. So, just to give an example of the kind of things that we would be looking at in future, we'd be looking at the nature of calls to NHS 24. So if we suddenly find in a part of the country, before we've got any, indication through positive COVID tests, if we find that there has been a spike in people calling NHS 24 with respiratory problems, for example, that would be something that would trigger us to do a bit more investigation. So we are trying to get as much data as possible for our own purposes and for local purposes, and to have that as upstream as we possibly can, so that we have as much chance of stamping out and containing any localised outbreaks.
So two quick things. The Dumfries and Galloway Local Resilience Group will of course be in touch with one another. The NHS Chief Executive, I know, is already engaged in these processes, and the public health leaders, and they will be in touch with what we have in each of our areas around Scotland, a local resilience group, which is the local authority, the police, the fire service, the health service, and anybody else who needs to be involved in that process. And I have absolute confidence that they will engage appropriately. Let's not get this cluster out of perspective. It is single figures. It is so far contained, and the processes we have in place will, we hope, keep it contained. The second thing I was going to talk about was the early warning scoring. So the early warning system. Around the world just now, countries are working on what early warning might look like for this new virus, relatively new virus. And the First Minister is correct. Just this morning, the Chief Statistician and I did some media on what our data might look like if we looked for early signs before testing, before hospital admission, so that we can intervene at the earliest possible moment in institutions or regionally. And that work is internationally learning, and we will do it just as fast as we can.
I wouldn't overlook the fact that we are standing here giving as much information as we can at this stage in a local investigation, and answering the detailed questions that we are answering at a point when we have had, as of yesterday, 5 confirmed cases, should give people a degree of assurance. Now, obviously, this is an ongoing investigation. The situation might change. I can't rule that out. But what I fear, and again, we're working hard to avoid this, is a situation where we become aware of a local outbreak when it is already transmitting in the community. So you might have 100 cases, and whatever we do, it is being reactive and possibly too late to stop that spreading further. So everything about this virus right now is concerning and causes anxiety, and that is understandable. But take some reassurance from the fact that at such an early stage, the detail that we are sharing with you right now, it gives a sense that the local teams, as well as the Scottish Government, are absolutely engaged in making sure everything is being done to contain this. Alistair Grant from the Herald.
Hi there, thanks very much. Just to go back to the kind of cross-border quarantine row, I appreciate you're saying you don't have any plans to do this yet, but you're also very much still keeping it on the table, it sounds like. But how could a 14-day quarantine on travellers from England or elsewhere in the UK possibly be policed or enforced, given I think Ian Livingston was saying yesterday that the current 14-day quarantine for people from overseas, the police in Scotland have difficulty enforcing that as it stands?
Can I just make a point before I come on to the detail of your question, a preliminary point, and I'm not having a go at you, Alistair, I'm just observing, I suppose, on how you framed the question, because others will be using the same language. The fact that we are describing this as a row should make us all take a long, hard look at ourselves. Look around the country, the world right now. I've already talked about America. You'll have the same situation between different landers in Germany. I just got tweeted by a public health expert, I think, in Australia this morning, saying something along the lines of, this is standard between states and Australia. Other countries are just doing what they need to do in a public health sense to try to stop the transmission of a virus. We're talking about Dumfries and Galloway here. I hope it doesn't. But just for argument's sake, if we don't succeed in containing this and it was to run out of control, then we'd be looking at how we stopped it moving from Dumfries and Galloway into other parts of Scotland or south into England. This is public health. And the fact that in Scotland we are trying to turn it into, and I'm saying we to be charitable because it isn't me, but the fact that some are trying to turn this into a kind of standard political constitutional row is frankly disgraceful. And if I ever stand here and say, you know, I'm worried that this might be seen politically or constitutionally, so I'm not going to consider an option that could actually save people's lives. If you ever hear me saying that or suspect that's the way in which I'm dealing with this, then that's the point you will know I've stopped doing my job and carrying out my duty properly. And I am determined I'm not going to get into that position. Now, on to your question. Yes, there would be a lot of practical considerations, as I'm sure there are between American states and Australian states and, you know, different parts of Germany or other parts, just as there are real practical difficulties right now in the UK government having reimposed a lockdown in Leicester, but not surrounding areas of Leicester. These things throw up huge practical difficulties. They have to be considered. There is no approach here that will be absolutely foolproof in every situation. What you need to do is consider everything that might contribute to reducing the risk of the virus spreading. And there will be circumstances in which a particular measure might not be thought to be practical for some reasons, whereas in another context it might be. These are the kind of decision-making processes I and the government and my advisors are having to go through on a daily basis right now, with one objective and one objective only in mind, and that is trying to stop this virus getting out of control and moving from one household to another, or one part of Scotland to another, or from Scotland to England, or from England to Scotland, or from international countries into Scotland. That's all that drives this decision-making process right now. And I really do say to people, whether it's the leader of the Scottish Tories or the Secretary of State or even the Prime Minister, who I have been at pains not to criticise over this, if you find yourselves trying to turn any of this into a political or a constitutional argument, go and take a long, hard look at yourself in a mirror. And if you're being honest with yourself, you will admit that you're failing people or risking failing people. So I'm not going to do that. I've said that from day one. And however long this crisis lasts, I'm going to stick with it, because I take my responsibility to the best of my ability to protect Scotland from this virus more seriously than perhaps I've taken anything in my life before. And with that, I'll move on to Tom Peterkin from the P&G.
Good afternoon, First Minister. Just to move back to the tests at RAF Lossiemouth, how confident are you that this will be contained? And can you say when will we get the PCR test results? How long will that process take?
Jason, but can I just emphasise a point that Jason's made, I think, 2 or 3 times now? We don't yet know that there is anything in Murray to contain. And that's a key point, that the tests, as we understand it, or I think now know, that were carried out on the individuals concerned were antibody tests, not antigen tests. Now, the fact that they are positive suggests that they may have had the virus previously. It does not confirm that they have it now. And therefore, we don't yet know there's anything to contain. But all of these steps that are being taken are acting on the assumption that there might be, so that it's ultra precautionary. And all of the steps that would be taken had these been positive antigen PCR diagnostic tests are being taken anyway. And again, that should, I hope, give people in the local area some assurance. But Jason, do you want to say a bit more about the testing process?
So that's correct, First Minister. The antibody test would not normally be done in the National Health Service, but it was done by a private company. They have chosen to isolate the 2 individuals who were positive. That is precautionary. If they had previous infection, and antibody tests tend to show late antibodies, not immediate antibodies, and therefore it means the infection was some weeks ago. I can't be absolutely certain, but that would be conventional antibody testing. That would mean these individuals are not infectious to those around them, but they have isolated them. Those tests were done yesterday in Inverness. They will be back, I would expect, today. It wouldn't be right for me to announce those results here. It's very important that patient confidentiality and the individuals in question get those results from the health service in the normal way, and then the public health team in Grampian will then decide what is appropriate to do next. If they are negative, this is not a cluster, this is not an infectious group, and with the reinforcement of guidance on testing, transport and workplaces, then this cluster will be closed down. This non-cluster will be closed down.
Thanks. Christian Lavelle from The Sun.
Thank you, First Minister. It was just a question from Professor Leitch on the back of comments that you made to the BBC last night, effectively ruling out fans returning to football and rugby games until sort of at least October, when social distancing would still probably be in place. I just wondered, how much of stadium capacity do you envisage being filled when supporters do start going back to grounds?
I am not sure that is a question that is even fair to put to Jason right now, to be honest, but I would never try to stop Professor Leitch from speaking, so I will allow him to it. But I mean, you know, stadiums are of different shapes and sizes. These are decisions that lie in the future. I'm just not sure it's even a reasonable question to ask, but there we go.
So what I can tell you is that the sporting bodies, the very professional bodies that I've been engaged with over the last few weeks, in fact, have done work on what that would look like. Very provisional work. And I stand by what I said yesterday to the BBC, that I don't see a stage beyond behind closed doors games until much later in the year. I can't tell you when. I don't have the same crystal ball that the First Minister doesn't have. But so I said kind of October last night, but it was heavily caveated. The stadium work is ongoing, whether you're in St Johnstone or Hibs or Murrayfield, and they have worked out what 2 metres would look like, what family groups would look like, and that work is really good, and they should keep it in the drawer until they are authorised to use it. The other thing we said yesterday was that, of course, there will have to be some test events, probably with very small crowds, to work out the one-way systems, to work out where the alcohol gel should be, and all of that would have to be in place. And Murrayfield might be one of the places where that would be able to take place. But again, we're a while away from doing that. And today's news, I think, reinforces why we're a long way away from that.
It shows I should never underestimate Professor Leitch's ability to answer a question. So thank you for that. It's always correct, can I just stress. Simon Johnson from The Telegraph.
Hi, First Minister. I just wanted to follow up on Alistair's question, really, on the enforceability of some sort of quarantine system. Hugh Pennington this morning said he thought it would be impossible to police and impose cross-border quarantine because of the open border. I just wondered if you could set out how this operates in other countries. You've mentioned the States, and whether it would require some sort of border check.
I suggest you go and look yourself at how it operates in other countries. If you don't mind, I'm going to concentrate in Scotland. What I do know is it does operate in other countries, and nobody thinks of it as a political or a constitutional row. They think of it as sensible action in particular circumstances to tackle a virus. If I, in the future, was to decide that steps like this were necessary in order to tackle the virus in Scotland or stop it surging again, then I would have to set out the basis for that. It would not be a decision I took lightly. And at the time I took that decision, I would both set out the basis for it, the reasons I was taking it, and the practical measures that we had to put in place to enforce it. And that's been the case at every stage. When we imposed lockdown, we had to set out the enforcement mechanisms and the practical considerations. Similarly, when we made face coverings mandatory on public transport at every step of the way. I know that doesn't translate very easily into a dramatic and overhyped headline, but unfortunately, just as this is not about politics or constitution, it's also not about writing newspaper headlines. It is about doing things to try to stop a virus spreading, because we know from our experience of the last 3 months, when the virus spreads, people die. And I'm sorry, I'm not going to apologise for wanting to do everything I can to try to stop people dying if I possibly can. Tom Martin from The Express.
Hi, thank you, First Minister. Just briefly, just a little point of clarification. On any potential quarantine system, presumably it would have to apply to Scottish holidaymakers or business travellers returning from other places. And secondly, if I may, just a lot of people will be looking ahead to the expected relaxation of the 5 mile rule on Friday. People that may have already made plans, but given the emergence of this cross-border cluster today, should they perhaps be thinking again on that?
Well, look, if I come forward with a proposal for quarantine, I will set out who that applies to and what the practical arrangements are. I've said what I've said about that, about why it would be reckless and irresponsible for me to rule things out at the moment, but equally I'm not going to speculate and hypothecate about what might or might not be done. I've got a duty to take decisions in an orderly way and to set out the basis for and the rules around those decisions when I do. I suspect, as I say, no offence, I suspect that will not influence in any way, shape or form what appears on the front page of the Daily Express tomorrow, but that just is a fact of life. And on issues around relaxing the travel rules, I'll set out tomorrow our assessment of that. I hope to be in a position to confirm what I set out to Parliament last week. But we will continue to monitor these local flare-ups. What I want to be in a position, if at all possible, of our public health experts doing is containing any clusters, outbreaks, flare-ups. This is a cluster, I think would be best to describe it just now, in a way that doesn't entail tougher measures and doesn't entail different approaches in different parts of the country, or doesn't entail us having to reverse actions that we've already announced or taken. But I can't be certain about any of that because, as I say, this is a pathogen, this is a virus. It doesn't, unfortunately, respect the instructions that politicians like me might want to give it. And therefore, we have to adapt depending on how it happens. But what I do know is, two things, related things. If we continue to do all the right things, the facts that I keep going on about, we minimise the risk of it spreading, we get it to a lower level, and if we get it to a lower level, then our ability to deal with these localised flare-ups in a very precision-based, laser-like way becomes much greater than our ability will be if we have virus circulating at a more general community transmission level. So all of these things are connected, and it all comes back to each one of us as individuals. The government can do what it can do and will do everything it can, but the individual responsibility every single one of us has right now, every time this virus spreads from one individual to another, then it could be because somebody hasn't washed their hands properly. It could be because somebody has come too close to somebody else. It could be that they've touched a surface that somebody else is going to touch and not cleaned it in between. It could be they've gone into a shop without wearing a face covering, didn't realise they had the virus and therefore have passed it on to somebody else. So if these are the ways in which we know we can spread the virus, flip that over. These are the ways in which we know we can stop the virus spreading. So ultimately, every single one of us as citizens here have a responsibility for ourselves, but also for the greater good. And that becomes more important as we relax these restrictions, not less important. Scott McNabb from the Scotsman.
Thank you, First Minister. We've had 8 new positive cases today. I think it was 10 yesterday. I'm wondering whether you believe participation levels in Test and Protect are where they should be. And I think you alluded earlier to catching 80% of index cases. Does that mean you would expect that 80% of people who pick up the virus should be contacting Test and Protect? And do you believe that's where we are with numbers?
No, I think everybody who has symptoms of the virus should be contacting Test and Protect. But the 80% is an assumption that not everybody will, or some people will not have symptoms and have the virus. Now, we want to get that as high as possible, but that is the kind of benchmark for it. At least you want to be getting to 80% of index cases. If I'm getting that wrong in any way, I'll hand over to Jason, who can correct me around that. We have also just published, or just about to publish, the weekly figures on Test and Protect, and there will be a variance between the figures we are publishing daily and the numbers testing positive through Test and Protect, because there will be sometimes maybe somebody's been tested more than once in that, but nevertheless that gives you the detail on who has come through Test and Protect. Test and Protect is operating well in my view. We should hopefully be seeing not that many people go through it right now, because with the prevalence of the virus reducing, not that many people should have symptoms as we go into the winter. I think we see much more pressure on Test and Protect because people with the symptoms we describe could have these symptoms because they've got a cold or a flu as well. So the fact that there's not that many people going through Test and Protect right now should be a good sign, as long as we are getting everybody that we need to get. It's working well, but it's not a new system, because this kind of contact tracing is a well-established public health intervention, but on the scale we're doing it just now, it's new. So we have to, week on week, day by day, make sure we are bedding it down, developing it, building it into the force that we need it to be now, but in particular, the force that we need it to be as we start to go into the autumn and winter months. And that is very much an ongoing process. Jason, do you want to correct anything that I might have got wrong there?
You were right. We want everybody. I'd much rather have a pile of negatives and a little bit of inconvenience of having a swab test to get more positives. So we want everybody with symptoms inside the system. The 80% of that is a kind of modelling number that public health experts use around the world, and for 80% of contacts. Just now the contact numbers are low because we are not in touch with people, not everybody is at work, so not everybody is on public transport. That will get harder, and that's why we have the ability to ramp up that test and protect system when we need it. Remember, even as we hopefully remove the travel restriction, like our previous questioner asked, the way to not be contact traced is to keep away from people outside your household. It's very straightforward. Keep 2 metres apart from everybody outside your household. You won't catch the virus and you won't be contact traced. Not quite as simple as that, but roughly speaking, that's the advice.
And it's important advice. If the travel limit is lifted at the end of this week, so the 5 mile guidance is no longer in place, that's good and it's important. But it doesn't mean you have to travel more than 5 miles if you don't need to. And anywhere you're going outside your own household, that physical distance remains really important, as do all the other things that we are talking about. Vivian Aitken from the Daily Record.
Good afternoon, First Minister. I was talking to a care home provider, the CEO of a charity where there have been no deaths in Scotland. And he says in his English care homes, 90% of his staff and 80% of his residents have been tested. In Scotland, only 10% of staff and residents have been tested. He says, in his words, this is playing with fire. He's seen you say that things are improving and that in Scotland the plans are for long-term testing. But he says these statements play well with the public who don't know what's going on, but as a major care provider, they're left playing Russian roulette. He's also calling for a national care service and says it is time Scottish and UK governments were accountable for the fragmented, broken system as he sees it. What is the current position of testings in care homes? And when can we expect proper regular testing? And what are your views on a national care system?
I'm going to hand over to the Health Secretary to give more detail on this, but firstly, I'm on record as being supportive of a national care system, but there's a lot of complexity lies under that, and we have to work our way through that. And I think this crisis perhaps gives us renewed impetus to do that. I think my accountability is clear for all to see. There's an accountability on the part of care home providers as well. I've said all along we should work together, and we have been working together on testing. The Health Secretary will give the detail. The weekly numbers will be published. I think they're published at 2 or 2:30 today for the numbers of staff in care homes that have been tested. That last week was more than 20,000, which is a very high proportion of those who will be in work in any given week. But there's also a responsibility in care home providers for them to make sure that they are working with the system, either through the portal or the other systems, to make sure that their staff are taking advantage of the ability to be tested as well. Jeane.
Thanks very much. So the numbers tested for the week that ended, that began the 22nd of June, was 23,350 care home staff. As the First Minister said, that is just about 10,000 short from the numbers that you would expect to be testing, but up 8,500 from the week before, 16,000 from the week before that. So the numbers are growing week on week, as I would hope they would. Still not fast enough for me, but significant progress being made. That covers returns from 93% of care homes across Scotland. With respect to what the particular gentleman that you were speaking to said, Vivian, of course, care home testing is accessed through the care portal by the care homes themselves. With NHS support, then the testing is done for care home staff. So if that particular gentleman would care to contact me, maybe he's having difficulty, or his care home is, in doing that registration or acquiring those test kits for his care home, and we'd be very happy to help him sort that out and make sure that he can access it the way those 93% of care homes have done so far.
But that's an important point, and it's not trying to pass the buck, but care home providers should not be sitting saying, I can't get access to testing, because they have access through the portal to get the test kits with NHS support for their staff. So if there's a misunderstanding here, we would be happy to work with whoever it is to sort that out quickly. Matt McLaughlin from The Times.
First Minister. Prime Minister's questions just before this briefing started. The Prime Minister was asked by Andrew Bowie whether there'd been any discussions with the devolved administrations about, quotes, deeply irresponsible, damaging and divisive talk of arbitrary border closures and quarantining visitors from across the UK. The Prime Minister responded, I'll resist the temptation to do the voice. I must say I find the suggestion absolutely astonishing and shameful. There have been no such discussions with the Scottish administration about that. And I would point out to my honourable friend what he knows very well: there's no such thing as a border between England and Scotland. So is it true that there's been no discussions with UK ministers about border closures, quarantine? If it is true, why not? If this is just, perfectly respectable, non-constitutional discussions to have, why have you never discussed it at the Four Nations or COBRA or anything like that?
Well, there hasn't been a COBRA since May sometime, so I can't discuss things in COBRA meetings that the Prime Minister doesn't call, because COBRA meetings are for him to call. I have no proposal on the table to have quarantine for people coming in to Scotland from the rest of the UK. So there is nothing to discuss right now. If that changes, and my point is, I would not be doing my job properly given the nature of what we're dealing with right now. Just to remind the Prime Minister, an infectious virus. I would not be doing my job properly if I ruled things out that, as we see from countries around the world, are being used selectively in appropriate circumstances to try to contain a virus. So if I have a proposal, because if I'm looking at the data and the evidence and I'm seeing that there's a risk to Scotland of infection coming in from other parts of the UK, and I think that there needs to be measures taken to contain that, then I will discuss that with other administrations as appropriate, although the decisions, if it is about protecting Scotland, would be for the Scottish Government to take. So we will discuss things when we've got things to discuss. I don't want to go over what I've said previously again. The fact that I'm having to stand here, given the nature of what we're all dealing with, the Prime Minister included, and respond to absurd and ridiculous political comments, it should be making people really look hard at themselves. There is no border between Scotland and England. I mean, it's just such an absurd statement. What there definitely is a geographical boundary to my powers as First Minister. And if the Prime Minister is questioning that now, I'm not sure what he would say if I pitched up in Newcastle and started to try to implement Scottish Government policies in Newcastle. And see what I've just said there? It's absurd too, which is why we shouldn't be having these discussions. We should be focusing, all of us, with an absolute laser-like focus on what we need to do within our own responsibilities and working together where necessary to stop a virus. This is not a debate about whether or not Scotland should be independent. My views on that are known. The Prime Minister's views on that are known, although sometimes can be more fluid on a number of things. But this is not about that. This is about a virus that kills people and does a lot of damage. And everything we talk about right now should be about how we stop that. And I'm going to try my hardest, except when I'm dragged into having to respond to absurd politicised statements. I'm going to try my hardest just to focus on the job at hand, because that's not just my job, that is my duty right now as First Minister, and I take it, as I said a moment ago, very seriously. Rachel Watson from the Daily Mail.
First Minister, we're anticipating an announcement on air bridges, and I just wondered, if you decide to take a different approach from the UK government, what is there to stop someone from Scotland travelling to, say, Manchester or Newcastle Airport to go on holiday, and how would that be policed on their return? And also, Ian Livingstone has said that Police Scotland are not made aware of breaches, on current quarantine rules. And I just wondered if you can therefore tell us how many breaches have there been and how many fines have been handed out to people who have breached the 14-day quarantine rule.
I don't have that information to hand. We can get that information for you and give it to you. I'll be very brief in my answer here because I think I've covered a lot of this ground already. If on anything, whether it's air bridges or quarantine or any other aspect of tackling this virus, I choose to do something different to a decision that perfectly legitimately Boris Johnson is deciding to do for England, then there's a number of things that you can assume will be the case. Firstly, I have very seriously looked at the evidence and decided that that is necessary, not for political or constitutional reasons, but necessary from the point of view of tackling the virus. And if I reach a decision of that nature, and I've reached decisions of this nature in the past, I will set out why that is the case, and I will set out the practical problems, challenges, implications that flow from that and how we will try to deal with them. But I will do that in an orderly way, and I will do that on the basis of evidence and judgment about tackling a virus. And I'm not going to be, the media can write what they write, the front page of the Express or the Mail or the Telegraph tomorrow, I could probably write them right now myself. They can say what they like, but at the end of the day, the most important duty I've ever had as First Minister is doing everything I can within the constraints of what we're dealing with right now and within the constraints of the powers I have to protect Scotland from this virus. Sometimes that will make me unpopular. Sometimes people will disagree with those decisions. But at times like these, any leader worth their salt has to be prepared to just have the gumption to do the right things for the protection of life and public health. And that's what I'm going to continue to try to do at every single step of this for however long we might be dealing with it. Derek Keeley from the Courier.
Thank you, First Minister. I wanted to ask you about people who have suffered long-term health implications after contracting COVID-19, sometimes for many months after first getting the virus. One individual I've spoken to, a 28-year-old former keen runner, said more than 100 days after first showing symptoms, he's been left unable to walk any significant distance and is currently living with family because he's unable to care for himself. He's worried he may never get back to where he once was, but he's also concerned not enough is being done to investigate the causes and potential treatments for this. Can you tell us from a government standpoint what has been done to prepare long-term support for people affected this way, and possibly to Professor Leitch, if I may, what current understanding in terms of how many people have been left with long-term complaints and why?
I'm going to hand over to Jason in a moment, and then I'll hand over to the Health Secretary to say a bit more about the Health Services approach to this. But very briefly from me, one of the reasons why I think we have to continue to take this virus so seriously is that the more we learn about it, the more we learn how damaging it is. From a very early stage, we have known that particularly for people with some underlying health conditions or other vulnerabilities, age, for example, that it can be deadly, unfortunately. One of the things that took us longer to start to learn and are still learning is that even for people who don't become very seriously unwell and who certainly don't die from it, it can still do really long-term damage. Now, we don't fully understand that, although Jason can give you a bit more insight into the state of knowledge about that. But that is something, no doubt, we're going to continue to learn because, by definition, people who've had it haven't had that long yet from recovery. So there's a limited knowledge about what damage it might do and still be doing a year or 2 years from now. But we do know that this is a dangerous, infectious virus, and that's why we have to continue to take it as seriously as we're taking it. This is not the flu. And that's not to say that the flu comes without complications, because it doesn't. For a lot of people, the flu is a very serious illness. But this is not the flu. It is a virus that, yes, can kill some people, but also can do real damage. And that just underlines everything we're saying. We can't take our eye off the ball. We can't be complacent. We can't drop our guard against this, even as we see the numbers of people dying start to reduce. Jason, do you want to go first, and then I'll hand over to Jeane?
Yeah, some of the reactions to this virus are predictable. So we know that if you spend a prolonged period in intensive care, you tend to suffer physically and mentally from that. So you get post-traumatic stress in a certain group of people, you get sustained respiratory disease in people, but there's also an unpredictable group of diseases ongoing. The first person to get this virus in the world got it 6 months ago. The first person in Scotland to get this virus got it 4 months ago. So the science is very, very young. The clinical science is young. I get an email every week. Gregor and I get an email every week of the top 40 publications for COVID. Just the top 40. It's really difficult to keep up, even with the very peak of the science. So the intensive care communities, the respiratory rehab communities, the vascular rehab communities, because we're finding out this is a disease that affects diabetics, people who are obese, people who have heart failure, a different category than we expected from just the respiratory disease. And we are putting in place all of the rehab elements we can, and the Cabinet Secretary will talk more of this. We sent her a briefing just this week about how the health service, in its remobilisation plans, will have to think not only how it deals with acute COVID cases, but also how it deals with, if you'll forgive, chronic COVID cases that are still suffering because of this horrible disease. My final point is exactly the same as the First Minister's. This is why prevention is so important. It's not just about stopping the 87-year-old from dying. It's about stopping the 30-year-old from having months and years of rehabilitation from pulmonary disease.
I read as many of these scientific papers as I'm capable of understanding, given that I'm not a scientist, but I think it's important to try to understand as much. And I read something the other day, and I don't know whether every scientist, expert, clinician would agree with this, but it was, for a layperson like me, it helped me understand this a bit more. And it described COVID as a disease that enters your body through the respiratory system, but it doesn't necessarily stay in the respiratory system. It can damage other parts of your body. And I think that is just an indication of the way in which knowledge of this virus is developing. But everything I've learned about it tells me not that we should be less cautious, but that we should be more cautious as we continue to try to suppress, eliminate and keep it under control. Jeane.
Thanks very much. So, as Jason said, this is an area where knowledge is developing all the time, and what we have to make sure is that our health service is alert to that and is making what plans it can, but remains flexible enough to respond as that knowledge develops. So in our remobilisation work, as we're looking to safely restart those services in the health service that were paused in order to deal with the early stages of the pandemic, we are factoring into that a recognition that there is a need for both rehabilitation services and support, or an increased impact and demand on those services, but also a recognition that there may be long-term conditions that people develop, either that are respiratory or are vascular, or in some instances perhaps in terms of renal, that people will need a longer-term response. So there's the immediate response that sometimes that people need significant help from physio and others to recover from having the virus, but others will be left with longer-term conditions where we need to make sure the health service can answer that demand and provide the care and support that's needed. And the other area I'd mention, all of that is about physical impact of the virus, but there can be and is significant psychological impact of the virus. For people certainly who have been any length of time in intensive care, but also for others. So there is a trauma part to this. And we have in Scotland a very well-developed and effective trauma network that deals with other kinds of traumas. And you'll know that we're expanding that. So there's a body of expertise in that trauma network that we are now looking to apply to help us work out exactly what kind of psychological support should we be offering to people now, but also in the longer term.
Thanks. That concludes the questions we had today. Thanks to the journalists. My thanks to Jeane and Jason. Can I also say a big thanks to Yvonne, our BSL interpreter, for today. Let me end with just 3 quick points. Firstly, we are making huge progress against this virus. The figures I report every day bear that out. But the cluster we have been talking quite a lot about today in Dumfries and Galloway is a timely reminder to us that the virus is still out there, it is still as infectious as it ever was, and if it takes hold, it's still as dangerous as it ever was. And we need to work really hard to keep it under control, and our public health teams in Dumfries and Galloway and elsewhere are doing that right now. Second point is this, right throughout this crisis, and no doubt for some time to come, governments everywhere, including the Scottish Government, will have to take really tough decisions to control and keep this virus under control for the purpose of saving lives and trying to stop people get infected and perhaps run the risk of these longer term health complications that we've been talking about. These decisions have not always been, and they will not always be, popular. Because any leader or any government in a situation like this that sees it as a popularity contest is not doing their job properly. So we will take the decisions that need to be taken to protect the country, and we will not shy away from those. But one thing you should be assured of at every turn is that these will be decisions driven by public health and not by politics and not by the Constitution. And if others want to try and make it to do with those things, then they're doing a real disservice to the challenge we face and the work that all of us have to do to meet and address that challenge. Third and final point is the one that you make me hear all the time, and I will continue to make. Please remember your role as an individual citizen in the work collectively that we have to do to keep this under control. And it comes down to those facts again: face coverings in enclosed spaces, avoid crowded places, clean your hands, clean any hard surfaces that you're touching, keep 2 metres distant from people outside your own household, and if you have symptoms of this virus, self-isolate immediately and immediately book a test, because that helps with the kind of effort that we're seeing in Dumfries and Galloway right now to use these public health interventions to keep this virus under control and to stamp it out when we do see flare-ups arise. So with those 3 comments, we will take our leave of you. I'll be back here tomorrow at 12:30 when I'll update on the easing of some lockdown restrictions. I'll have more to say about the 2 metre, 1 metre physical distancing issue tomorrow, and as I indicated earlier on, some announcements to make that hopefully allow the children and young people watching to enjoy the summer holidays a bit more. For now, thanks for joining us.